in our world, I just spent 4 hours on another Zoom conference on a new agent, a neuroprotective agent. Mm-hmm. So over the time, 30 years, I used to have more hair, dark hair. I was good looking too, but that was a long time ago. So that's when we started with neuroprotection. Way back, when I finished my training as a neurologist, I did my fellowship in neuroprotection. How do you protect the brain if the artery is occluded? So 30 years later, we still don't have a drug. We have 2 ways of improving function. One is the drugs like TNK and TPA, or more recently, put a little tube up, pull the clot out. Those things seem to work very well. But there the problem is that you need extreme expertise. You need to have people who are well trained, because these treatments have side effects, like bleeding, for instance. And you can never start the treatment until such time that you've done a CAT scan. So, which limits it to initiating this drug in centers that have CAT scans, right? So the advantage of a neuroprotective agent is that if you suspect a stroke in an ambulance or in a small town, as the patient is being transferred to the tertiary care center, you can initiate the treatment. So I'll give you an example. So one of the things that we've been working for years on is hypothermia. So you think it's a stroke, you have a helmet, you put it on and cool the brain. So if you were wrong, doesn't make any, you haven't harmed the patient, right? So in here, in neuroprotection, that's appeal for neuroprotection. The problem is that, as I said, in 30 years, we've tested over 100. In my personal experience, there's over 100 compounds and nothing has worked. So it's been a bit of a disappointment that way. So what is happening now is that we've learned a lot about the brain's ability to respond to ischemia. So these newer agents are looking at enhancing recovery. So the antibody that you just mentioned is a. I'm trying to make it. I'll try to make it simple because it's actually very complex. So in fetal life, when the brain is being developed, there are guidance molecules. So the guidance molecules, what they do is they guide these axons or dendrites to connect between cells. And there are 2 types of guidance molecules. One are the molecules that inhibits movement. So RGMa, so restrictive guidance molecule, and the one that the antibody is against is A, so RGMa antagonist. Now, once in post-fetal life, these restrictive molecules disappear. But it's been shown recently, and we've done some of the work ourselves also in our labs, that if you have a stroke, or if you have brain trauma, or if you have MS, so multiple conditions, then the RGMa, the restrictive guidance molecule A, it reappears. The hypothesis is that is slowing recovery. So the antibody is an antibody against RGMa. So it's a double negative. You're inhibiting a negative molecule so that you can improve recovery.